neglected, remote, and drought-prone, words that best describe the small, backward town of Pavagada in Karnataka. Battling droughts year after year and without any natural sources of water, the largely illiterate and agrarian population of this town has remained poor. The oppressive heat, lack of awareness about personal hygiene, and absence of basic healthcare facilities made Pavagada a hotbed of diseases like leprosy, tuberculosis, and blindness. Help for these long-suffering residents came in the form of Swami Vivekananda Integrated Rural Healthcare Center set up by Ramakrishna Sevashrama in 1991. Offering facilities for eye care, leprosy and tuberculosis control all under one roof, the center serves nearly 600 villages and more than 800,000 people. And helping the center serve the people of this remote and rural area better is Infosys Foundation.
Pavagada is a place where a lot of fluoride problem is there. It is a place where a lot of blind people are there. It is a very neglected place. It is also a place where a lot of unrest is there. It's extremely hostile weather. They are very helpless people. And there I realized that no doctor goes, nothing is happening. I really feel it is one of the very good projects where a selfless work and it is affecting so many needy people. That made me to work at Pavagada.
The foundation started supporting the leprosy eradication program of the center in 1998. Since then, it has extended support for various initiatives which have had a lasting impact on more than 500,000 people. But controlling and eradicating deadly diseases like tuberculosis is a massive task, especially in rural areas like Pavagada.
We found about 15 years ago why the number of the cases are not getting cured properly, even though we supply the drugs freely. Then we found out the problem with the patients is perhaps he is the only bread earning member of the family. If you pump him with all these heavy antibiotics, within a week or so, he will face reaction of the drugs.
The solution for this problem was a unique one. The foundation launched the Food for Patients program. Under this initiative, the patients are given 5 kilograms of food grains every week to prevent the side effects of antibiotics. The program is one of its kind in the rural healthcare sector in India and has helped increase the coverage of patients under the tuberculosis control program. The focus of the foundation then turned to blindness control. The rural areas surrounding Pavagada did not have healthcare facilities to cater to the eye care needs of the people. To tackle the increasing cases of blindness in these areas, the foundation provided state-of-the-art eye care equipment to the Sharda Devi Eye Hospital. With more than 30 beds and highly qualified doctors, the hospital is equipped to handle eye-related emergencies as well as complex corrective surgeries. On par with the best hospitals in big cities, this super specialty hospital has performed over 15,000 eye surgeries for the rural poor free of cost. But the foundation did not stop at just blindness control and treatment. It also worked towards rehabilitating and educating the blind children through the Sharda Devi Institute of Vision Management. A daycare center, it provides food, clothes, basic education as well as training in music and life skills to these children.
ಇವಾಗ ಇಷ್ಟು ದಿವಸ ಮನೇಲಿದ್ದೆ ಏನೋ ಗೊತ್ತಿರಲಿಲ್ಲ. ಇವಾಗ ಸ್ಕೂಲ್ಗೆ ಬಂದಾಗ ಒಂಚೂರು ಬದಲಾಗಿದ್ದೀನಿ. ಬ್ರೈಲು ಪಾರ್ಟ್ಸ್ ಆಫ್ ಎಲ್ಲ ಕಲಿತಿದ್ದೆ ಮೇಡಮ್. ಬಟ್ಟೆ ಕೊಡ್ತಾರೆ, ಊಟ ಕೊಡ್ತಾರೆ, ಚೆನ್ನಾಗಿ ನೋಡ್ಕೊತಾರೆ.
Every morning, the Vision Management Center also serves nutritious breakfast to more than 100 poor and undernourished children from the surrounding areas to help alleviate the problem of malnutrition in this area. Though the integrated healthcare center caters to a huge population, there are still some areas that are beyond its reach. There was an urgent need to reach the unreachable. The foundation helped bridge the distance by providing a mobile hospital. Equipped with the latest medical equipment, the mobile hospital races from one village to another 6 days a week, treating over 300 villagers a day. Capable of treating various ailments as well as handling emergencies, the mobile hospital is a lifeline of these villages. The problems in the rural areas are aplenty. While the foundation has been working closely with the Integrated Rural Healthcare Center to address the healthcare needs of the people of Pavagada, there was another problem that needed urgent attention. Water scarcity is acute in Pavagada and surrounding areas. In the absence of water pipelines and depleting water tables, villagers would often trek for miles to fetch a few pots of water. Clean drinking water was a distant mirage for these villagers. Help came by in the form of this tanker provided by Infosys Foundation. Every evening, as the tanker rolls into these villages, the poor villagers rush out with their cans and empty vessels to claim their share of clean drinking water. For many, the long treks in the unforgiving heat is now a thing of the past. By continuing to support the various initiatives of the Swami Vivekananda Rural Healthcare Center, the Infosys Foundation will continue its endeavor of reaching the unreachable and serving the underserved of remote rural India.